You're watching the Fox 5 Morning News at 7.
Many restaurants in San Diego County reopened for dine-in services. Dr. Richard Chaffoo joining us now to explain what you can do to lower your exposure to coronavirus. Dr. Chaffoo, good morning. Good to see you.
Good morning, Shally. Good to see you, too.
We made the decision over the weekend to try out going to a restaurant. I went with wipes. I went with bottles of sanitizer. I went from feeling uncomfortable to feeling safe. It was kind of bizarre.
It's a new normal, so to speak. And the thing, Shally, is that, being in a restaurant, there is still some moderate risk associated with that. I think the important thing for everybody to understand is the concept of this 6-foot distance is based upon some old data. In other words, this is data based upon viruses that would travel in air droplets. And the truth is that while 6 feet may be helpful, it's probably, if you're in a restaurant, for example, and people are talking, they have a face mask off, or there's significant crowding or lack of ventilation, that can all spread this virus. Obviously, if you're sneezing, for example, the virus can be propelled, or respiratory droplets can be propelled up to 30 feet.
30 feet for a sneeze?
Yeah, it's amazing. Running the same thing. So the thing in restaurants, Shally, I think that, it's very important for us to remember the 4 take-home messages to keep us all safe. And those are eye protection, wearing a mask, social distancing, and then obviously hand sanitizing. But remember, Shally, that when we get into a restaurant environment, one of the issues is that we're in an enclosed space. And although we're separated by 6 feet, we're all taking our masks off, or at least when I go to a restaurant, I see that most people have their mask off because obviously you can't eat or drink wearing a mask all the time. And so if you're talking loudly or talking a lot, there's still some crowding, some lingering, some lack of that social distancing. So there's still some risk factors. And interestingly, in a study that just came out from China, they looked at this issue of people eating in a restaurant. And what they found was that there were people eating in a restaurant quite a long ways away from someone who was infected with the coronavirus, but because of the ventilation system, those people were exposed and got infected. So there are still some unanswered questions, and there are still some risk factors for sure.
With all the people and all the professionals and all the experts that I've interviewed over the past few weeks, what I am learning and what I'm hearing from you is it's all about reducing your risk. Right? All about reducing your risk. So do you go out? Should you not go out? Where do you wear a mask? Where do you wipe things down? So the things that you can do for those who do miss going out to a restaurant. And
sure.
What can you do then to bring those? I mean, I sat down and I was expecting disposable utensils. Those were not on the table, so I wiped everything. I should say my husband, he wiped everything down. He's a little more careful than I am, and then sprayed down the table even though it was sanitized. What other things should you be doing when you sit down?
The thing about utensils, I think what's important to remember is that, the utensils, if they're used and they go through a dishwasher, they're going to kill the virus. So it's not necessary, to be concerned about using disposable utensils. Similarly with the menu, a lot of menus, for example, if they're throwaway menus, they're very low risk. If they're not throwaway menus and they have a plastic coating, usually the restaurant owners will wipe these or sanitize these down. And just as you said, when you went out with your family, the tables were already sanitized, but some people just feel a little bit more comfortable bringing their own sanitizers or own wipes and wiping those surfaces down again.
I've had a few people, Dr. Chaffoo, message me and say, oh, you can't go to a restaurant, you get coronavirus from the food you eat.
Absolutely not. No, I think that's a myth that we need to dispel right now. Remember that this is a respiratory virus, Shally, and it enters through the respiratory system to get into our lungs, where, of course, people end up very sick and ill in hospitals. But eating food, let's say if it had virus on it, is not a way you can get that virus, because it will go into the GI tract and it will be destroyed by our gastric acid. So you're not going to get the coronavirus from eating.
What about touching something, though? Let's say you touched a food and then you touched your nose.
Okay, so here's the issue. If the food's been cooked, remember that the virus is going to be dead, so it's not going to be active. But the important thing to remember is the reason that we wear masks is so we avoid touching our face
Right.
and our nose, because that's the way that the virus particle enters. But also important to remember that in most kitchens, the kitchen prep areas have metal surfaces. And these viruses really do not last very long on inert surfaces, especially metal surfaces like copper. I mean, they'll last probably an hour or less in time. So those are not going to be really big risk factors. Again, the way we get viruses, whether it's a cold or the flu or the coronavirus, overwhelmingly is through respiratory droplets.
Yeah, and we had the WHO came out yesterday that they're saying that they don't even believe that asymptomatics is a driver of the spread of this virus right now. And that was big news from them yesterday.
And interesting, I think, to let people know, Shally, is that it takes up to about a week from when you get exposed to the virus until you become symptomatic. And during that week, you can be infectious. So just because you're in an environment where, you're around people that seem to be well, we're not completely out of the woods. And again, those 4 take-home points that you mentioned earlier on are critical. Wearing some protective eyewear, the mask, the frequent hand washing, and that social distancing are the take-home messages that the WHO and the CDC keep telling us to limit this spread of the virus.
Dr. Chaffoo, really good advice. Thank you.
Good to see you, sir.